हेलो एवरीवन, आज हम सॉल्व करेंगे कुछ कॉम्प्रिहेंसिव क्वेश्चन जिसमें एनक्लेक्स के सारे मिक्स क्वेश्चन है सिलेबस के। तो आज हम टॉप 50 क्वेश्चन स्टार्ट करेंगे। सो लेट्स स्टार्ट विद क्वेश्चन नंबर 1। So the question number 1 is on the screen. A client with human deficiency virus and acquired immunodeficiency virus confides that he is homosexual and the employer does not know his HIV status. Which response by the nurse is best? So you have 4 options and you have 10 seconds to choose the right answer. So what will be the right answer? So answer number 2 will be the correct answer. Because the information you confide में is confidential. हमको पूरे क्लाइंट की कॉन्फिडेंशियलिटी को अच्छे से मेंटेन करना है। अगर उसने बोला है कि इंफॉर्मेशन किसी को नहीं बतानी, एम्प्लॉयर को नहीं बतानी, सो वी विल नॉट शेयर द इंफॉर्मेशन विद एनीवन. So now question number 2 is on the screen. The mother of child with a bronchial asthma tells the nurse that the child wants a pet. Which of the following pet is most appropriate? So you have 4 options: cat, fish, gerbil, canary. What will be the right answer? So answer number 2 will be the correct answer, fish. Now the question number 3 is on the screen. An elderly client is being admitted to same day surgery for cataract extraction. The client has several diamond rings. The nurse should explain to the client that. So 4 options, which will be the correct answer? Answer number 2 will be the correct. The rings will be placed in the envelope. The client will sign the envelope and the envelope will be placed in a safe place. So now the question number 4. When an infant resumes taking oral feeding after a surgery to correct his intersuffusation, the parents comment that the child seems to suck on the pacifier more than since the surgery. So the nurse explained the suctioning on a pacifier. So what will be the right answer? So answer number 1 is correct answer, provides an outlet for emotional tension. So now question number 5. Under which circumstance may a nurse communicate medical information without the client's consent? So you have 4 options. Select the right answer. So the right answer will be answer number 3. When treating the client with a sexually transmitted disease, अगर किसी पेशेंट को STDs, STI हैं, तो उस सिनेरियो के अंदर नर्स पेशेंट के बिना कंसेंट के ही इंफॉर्मेशन डॉक्टर या किसी और मेडिकल से रिलेटेड पर्सन को दे सकती है. Now question number 6. A 22-year-old client is brought to the emergency department with his fiancée after being involved in a serious motor vehicle accident. His glaucoma scale is 7 and he is demonstrates evidence of decorate posturing. Which of the following is appropriate for obtaining permission to place a catheter for intracranial pressure monitoring? So option number 1, 2 and 3 and 4 is on the screen. So read the option carefully and let me know the right answer. So answer number 4 will be the correct. The physician will document the emergency nature of the client condition and that an ICP catheter monitoring was placed without any consent because it's an emergency. So now question number 7. A 68-year-old client's daughter is asking about follow-up evaluation for her father after his pneumectomy for primary lung cancer. The nurse best response is which of the following? So I have 4 options in the screen. What will be the right answer? So the answer number 4 is the correct answer. The follow-up for your father will be a chest x-ray every 6 months. So now the question number 8. The nurse is preparing to administer blood to a client who requires post-operative blood replacement. The nurse should use a blood administration set that has a. So 4 option is on the screen. Select the right answer. So the right answer will be 1. Micron mesh filter. Ninth question. During the health history interview, which of the following strategies is the most effective for the nurse to use to help clients take an active role in their health care? So what will be the right answer? Answer number 3 is the right answer. Ask client for their views on health and healthcare. 10th question. The nurse is planning care for a client who chews the finger constantly before applying mittens restraint. The nurse should try which of the following intervention? Select all that apply. So 4 option on the screen. Choose the right answer. So it's a SATA question, so you have to choose more than one answer. So answer number 2 will be the correct. Encourage physical activity as ambulation. Provide frequent contacts for communication socialization. Answer number 4 is also correct and 5 is also correct. Provide family education and encourage involvement of family and friends. So now question number 11. A client with severe depression states my heart has stopped and my nurse interprets this statement to be the evidence of which of the following? So if a depressive client says my heart has stopped and my blood is black ash, so what will be the right answer? It's a sign of delusion. So answer number 3 is the correct. Now question number 12. When a client wants to read the chart, the nurse should. Answer number 2 will be the correct. Give the client the chart and answer the client's question. Now question number 13 is on the screen. A client with fractured leg has been instructed to ambulate without weight bearing on the fractured leg. The nurse evaluates that the client is ambulating correctly if a client uses which of the following crutch walking gaits? 2-point gaits, 4-point, 3-point or swing to gait. So answer will be 3-point gait because the client has one leg fracture. So now 14th question is on the screen. The client with major depression state, life is not worth living anymore. Nothing matters. Which of the following response by the nurse is the best? So you have 4 options. Which will you choose? So the right answer will be answer number 1. Are you thinking about killing yourself? Because the patient has depression and he says life is not worth it. Now question number 15. The client with bipolar 1 disorder has been prescribed olanzapine 5 mg 2 times a day and lamotrigine 25 mg 2 times a day. Which of the following adverse effect should the nurse report to the physician immediately? SATA question, select all that apply. So what will be the right answer? So the right answer will be 1, 4 and 5. Now next question, a client is prescribed atropine 0.4 mg intramuscularly. The atropine vial is labeled 0.5 mg per ml. How many milliliters should the nurse plan to administer? So what will be the right answer? So the right answer will be 4 upon 0.5. So 0.8 ml will be the right answer. Okay. Now question number 17. A multiparous client tells a nurse that she is using medroxyprogesterone for contraception. The nurse should instruct the client to increase her intake of which of the following? सो मिड्रॉक्सीप्रोजेस्टेरोन वो पेशेंट ले रहा है तो पेशेंट को आप क्या ज्यादा लेने के लिए इंस्ट्रक्ट करेंगे सो द राइट आंसर विल बी कैल्शियम बिकॉज दिस ड्रग कोज osteoporosis and lack of calcium will be a reason जिसकी वजह से हमको कैल्शियम इंटेक को इंक्रीज करना है. Now question number 18 on the screen. Which of the following statements made by a pregnant woman in the first trimester are consistent with the stage of pregnancy? It's a SATA question. So answer number 1 will be the correct. Answer number 2 will be the correct. What else? Answer number 4 will be the correct. So these are the common symptoms in first stage of pregnancy जो कि एक female feel कर सकती है. Now question number 19. The nurse is teaching a client about using an topical gentamicin sulfate. Which of the following comments by the client indicate the need of additional teaching? So what will be the right answer? You have 4 answers to choose. So answer number 4 will be the correct answer because we should not apply this in large open areas. Because large open areas होंगे तो उनका ब्लड वेसल्स भी ओपन हो सकते हैं इंजरी की वजह से जिससे जेंटामाइसिन सीधा डायरेक्टली ब्लड में जाकर टॉक्सिसिटी भी कर सकती है. So now question number 20. The clients take hydrochlorothiazide, that is a diuretic for treatment of hypertension. The nurse should instruct the client to report which of the following? It's a SATA question again. So what will be the right answer? So answer number 2, 5 and 6 will be the correct answer. Now question number 21. The client has been taking imipramid for depression for 2 days. His sister asked the nurse, why is he still so depressed? Which of the following response by the nurse is most appropriate? Answer number 3 will be the correct. Now question number 22. Which intervention should the nurse use to assist the client with grandiose delusion? It's a SATA question. So what will be the right answer? So answer number 1, 2 and 3 will be the right answer. Now question number 23. Which of the following responses is the most helpful for the client who is euphoric, intrusive and interrupts other client engaged in conversation to point where they get up and leave or walk away? Answer number 1 will be the correct. When you interrupt others, they leave the area. This is the best way to recognize that person. So if you interrupt someone like this, so the person will might get away from that area. Now question number 24. At what time should the blood be drawn in a relation to administration of IV dose of gentamicin sulfate? So at what time should the blood be drawn in relation to administration of IV dose of gentamicin sulfate? So what will be the correct answer? So answer number 4 will be the correct, just before the administration of next IV dose, क्योंकि उस टाइम पे जेंटामाइसिन का ब्लड में लेवल बहुत कम होगा, तो उस टाइम पे हम एडमिनिस्टर कर सक निकाल सकते हैं, ब्लड विड्रॉ कर सकते हैं. So now question number 25. Which finding required immediate intervention when the planning care of an adolescent with cystic fibrosis? So the answer will be 2. Now question number 26. A 4-year-old is brought to emergency department with sudden onset of temperature of 103 degree Fahrenheit, sore throat and refusal to drink. The child will not lie down and prefer to lean forward while sitting up. Which of the following should the nurse do next? So what will be the correct answer? So answer number 3 will be the correct answer, because these are sign and symptom of epiglottitis, जिसकी वजह से उसकी ब्रीदिंग प्रॉब्लम हो सकती है, तो हम ट्रैकेस्टोमी ट्यूब वहां पर अवेलेबल रखेंगे. नाउ क्वेश्चन नंबर 27. Assessment of client taking lithium reveals dry mouth, nausea, thirst, and mild hand tremor. Based on the analysis of this finding, which of the following should the nurse do next? So what will be the right answer? You have 4 options on the screen. So the answer will be 3. Continue the lithium and reassure the client that these are temporary symptoms. Now question number 28. The client asked the nurse how long will it be necessary to take medicine of hypothyroidism. The nurse response is based on the knowledge that. What will be the right answer? So 4 options are there. So answer number 1 will be the correct. Lifelong medication is necessary in case of hypothyroidism. Now question number 29 is on the screen. The nurse should advise which of the following client who is taking lithium to consult with the physician regarding the potential adjustment in lithium dose. The right answer will be answer number 3, the client who is beginning training of tanning steam, because उसको sweating होगी जिसकी वजह से lithium toxicity हो सकती है. Now question number 30 on the screen. The nurse is discharging a client who has been hospitalized for preterm labor. The client needs further instruction when she says. What will be the right answer? So answer number 4 will be the correct. She says, if I travel on long trips, I need to go out of the car every 4 hourly. But in case of preterm, traveling is avoidable. We have to avoid traveling if the person with preterm, so we have to avoid the traveling. Now question number 31. The client admitted with a gastric ulcer has been vomiting bright red blood. The hemoglobin level is 5.11 gram per dl and the blood pressure is 100 by 50 mmHg. The client and the family states that their religious belief do not support the use of blood products and refuse blood transfusion as treatment for bleeding. The nurse should collaborate with the physician and family to do next. What will be the right answer? Answer number 3 will be the correct answer. Now question number 32. The parents of a child with cystic fibrosis express concern about how the disease was transmitted to their children. The nurse should explain what? Answer number 2 will be the correct. Now question number 33. A client with an angina shows the nurse nitroglycerin that the client carries in a plastic bag in the pocket. The nurse should instruct the client that nitroglycerin should kept in. So four options are there. What will be the right answer? Answer number 3 will be the correct. Now question number 34. When teaching a client with bipolar disorder who has started to take valproic acid, possible side effect of this medication, the nurse should instruct the client to report with side effects. What will be the correct answer? So answer number 3 will be the correct answer. Now question number 35. An infant is born with facial abnormalities, growth retardation, mental retardation and vision abnormalities. These abnormalities are likely caused by maternal. Four options are there. What will be the correct answer? So answer number 1 will be the correct answer because of alcohol consumption. Now question number 36. Non-steroidal anti-inflammatory drugs, that is NSAID, are commonly used in treatment of musculoskeletal condition. It is important for the nurses to remind the client to. What will be the correct answer? You have 10 seconds to answer. Choose the correct answer. Answer number 4 will be the correct answer. Now question number 37. The nurse should suspect that the client taking disulfiram has ingested alcohol when the client exhibit which of the following symptoms? So answer number 2 will be the correct answer. Now question number 38. The nurse holds the gauze packet against the IM injection site while removing the needle from the muscle. These techniques help too. What will be the correct answer? Answer number 3 will be the correct answer. Now question number 39. A client whose condition remains stable after a myocardial infarction gradually increases activity. Which of the following conditions should the nurse assess to determine whether the activity is appropriate for the client? The answer will be 3, dyspnea. Now question number 40. The client is conducting a counseling session with the client experiencing post-traumatic stress disorder using a two-way video telehealth system from the hospital to the client home, which is 2 hours away from the nearest mental health facility. Which of the following are expected outcome of using telehealth as a venue to provide health care to this client? It's a SATA question. So what will be the right answer? So answer number 1, 2 and 4 will be the correct. Now question number 41. When a client with alcohol dependency begins to talk about not having a problem with alcohol, the nurse should use which of the following approaches? Try to give the answer. You have 4 options. Answer number 3 will be the correct answer. Now question number 42. The nurse is caring for a toddler in contact isolation for respiratory syncytial virus. In what order should the nurse remove PPE kit? So what will be the right answer? So what should we remove first? We have to remove the most dirtiest one, that is glove, then gown. So first, second, third and fourth will be the right answer. Now question number 43. The nurse is preparing a teaching plan for a 45-year-old client recently diagnosed with type 2 diabetic mellitus. What is the first step in this process? Answer number 3 will be the correct. Now question number 44. A loading dose of diazoxin is given to a client newly diagnosed with atrial fibrillation. The nurse instructs the client about medication and the importance of monitoring his heart rate. The expected outcome of instruction is. What will be the right answer? You have 4 options. Answer number 1 will be the correct. Now question number 45. A multi-gravid client is scheduled for a percutaneous umbilical blood sampling procedure. The nurse instructs the client that the procedure is useful for diagnosing which of the following? Percutaneous umbilical blood sampling is used for. So the right answer will be 3. Now question number 46. Which of the following is an adverse effect of vancomycin and needs to be report? So what will be the side effect and adverse effect of vancomycin? Answer number 2 will be the correct. Now question number 47. Which of the following statements indicates that the client with a peptic ulcer understands dietary modification to follow at home? So what will be the correct answer? So answer number 4 will be the correct. Now question number 48. The client with angiotube has an abdominal distension. Which of the following measure should the nurse do first? So what will be the right answer? Answer number 3 will be the correct. Now question number 49. A client has been diagnosed as having a low sperm count during infertility studies. After instruction by the nurse about some causes of low sperm count, the nurse determines that the client needs further instruction when he says low sperm count may be caused by which of the following? So what will be the right answer? Answer number 4 is the correct answer because the sperm count decreases when the temperature increases. Now the last question, question number 50. A nurse is revealing the triage nurse in labor and birth unit who is going to lunch. The nurse report indicates that there is 3 clients having the vital signs assessed and 4th client is on her way to the unit from emergency department. Which of the order of priority should the nurse choose? So we have to choose the priority answer. So what will be our first priority? So this will be our first priority, answer number 4. then answer number 2, then answer number 1, and this is the last priority. Because the client who is term and has no fetal movement 2 days, that means the baby is died and अब हम कुछ नहीं कर सकते, so the answer number 3 will be the last priority. So we are done with all the question and answer related to our NCLEX. So it's all about today's class.